And Nigerian radiologists want more regulations and funding in all areas of the health sector so that the delivery system is improved to international standards. This formed part of discussions at the 4th Annual General Meeting and Scientific Conference, with speakers taking a cue from the theme COVID-19, the radiology perspective. Our correspondent Kemi Balogun has more in this report.
It is not the easiest of times for the medical profession as the world continues to battle the pandemic. The challenging issues this pandemic brings up are heightened not only by the impact of the disease, but also by the mitigation measures. This created far-reaching consequences and intensified the already complicated realities and strain on health institutions. Radiologists and other speakers here at this annual general conference believe that unless something is done differently, the nation could be faced with an acute shortage of well-trained radiologists.
Societies, groups, associations that are guiding the various medical specialties like RE ought to use this opportunity to take up the challenge of leading the world out of this medical quagmire, rather than a situation where we are sitting back and putting the matter in the hands of merchants. Medical practice may just be slipping away from medical practitioners, and we are beneficiaries of the result. And it is doubtful if this result will mean better healthcare to the majority of the world that needs it.
As we speak, we have over 24,000 health facilities in this country. 85.8% of this are of primary health care, 14 secondary health care, while only 0.2 is tertiary. That is not acceptable.
COVID-19, like you know, started as a health pandemic. It gradually spilled over to become an economic pandemic. Thus, the challenge was double-pronged, health and economic.
They believe that the healthcare system can easily be measured by the level of radiological infrastructural development or lack of it in the system.
Medicine is evolving. When we say some centers might still be using things that they've gotten more than, if anything you get 10 years ago is now almost obsolete. So that is a major challenge for us, and we need to come together to come and talk about it, to discuss and to know the way forward.
Solutions suggested at this conference is that these issues can be resolved by effective training of this cross-section of medical professionals. Kemi Balogun, TVC News, Abuja.